Now we're going to place a horizontal mattress suture. The horizontal mattress suture is similar to the vertical mattress. Because we pass the same knot with double thread, it gives a very effective, strong closure. It is also a quick and effective suturing method that provides consistently reliable results during wound closure. This suture is usually used when strong eversion is needed, such as in the palm, where the skin tends to invert. For this suturing technique, we have an open wound, and we want to close it carefully using a horizontal mattress suture. Here, we will place 2 equal bites. First, we pass the needle through the tissue and exit properly on the opposite side. Keeping the same bite depth and distance, we take the thread and go backhand at a measured distance here. From the opposite side, we pass laterally again and complete the needle passages across the entire suture line to finish this step properly. Because these 2 needle passages run completely parallel to the suture axis, we can clearly call this technique a horizontal mattress suture during the application. At this point, we have formed a loop here. This is important because knot tension becomes even more critical in this technique. If you close it too tightly, you may cause serious ischemia, meaning circulatory impairment, in the tissue between the suture passes under the loop. Therefore, we adjust the suture tension very carefully here and complete the knot while maintaining slight eversion at the final step. Once again, we complete the knot here with 2 secure half hitches. Let's repeat this. We take 1 bite at a distance, then take the same bite at the same depth and distance from the opposite side. Now we're going to make a second pass completely parallel to the incision line, maintaining the same distance and the same bite distance. We've completed the pass and retrieved our needle. We can clearly see eversion. We complete all knots while making sure they are neither too tight nor too loose. We cut it at a reasonable distance. Here too we use a monofilament suture because we generally avoid absorbable sutures on the skin surface. Because they may cause inflammation and irritation, we usually complete mattress sutures with removable monofilament sutures here. Now we are going to talk about the simple running suture. The key here is to make absolutely sure that the suture line and bite distance is proportional to each other, so no part of the wound is closed too loosely or too tightly.